Hello, everyone. Today is July 26th of 2022, and I'm here with Nathan. And if you could please introduce yourself and tell us about what your job is.
Thank you, Emily. My name is Baluku Nathan. I was born in a small village in the countryside, about 530 kilometers away from Uganda capital city, Kampala. And I am an assistant nursing officer, currently volunteering as an emergency nurse with the Ministry of Uganda under emergency medical services. And I'm working with Health Entrepreneurs Uganda as a telehealth nurse. My purpose is to have a positive impact on people that I meet and leave a legacy via humor. I believe laughter is the best medicine. Laughter will brighten up someone's day. The ability to laugh at ourselves and our mistakes is vital. Thank you, Emily.
Thank you so much. And yes, laughter is so important. It is wonderful to hear you say that. So, could you tell me what you were doing in December of 2019 and how your work might have shifted given COVID-19, the spread of COVID in the spring of 2020?
In 2019, I was working as a pharmacy dispenser, and at the same time, I was a student at a university pursuing a degree in public health, something that I didn't accomplish because of the restrictions that came with the preventive measures of the spread of COVID-19. That is to say, restrictions in the movement, gatherings, among others. So when that came in, the fact that I was staying away from my workplace, there was no way I could get means of transport since I was using public means, because public taxis were stopped. Motorcycles, the ones we commonly call border borders, were also restricted. So there was no way I could move from my home to the workplace.
Yeah, thank you so much. That makes sense. And then kind of looking at what you have done throughout the pandemic, could you speak a little bit more about how your work, was targeting pandemic response or a little bit more about the emergency response aspects?
So when the outbreak surged, the Ministry of Health called in for volunteers, all those people who have an academic or medical background, to come in and assist. So I went in and volunteered as an ambulance assistant, where my main roles were to safely evacuate COVID suspects from their homes to the nearest hospitals or medical centers or place of safety. It involved transporting COVID suspects on assisted breathing machines in an ambulance. Sometimes it even reached an extent of conducting emergency cardiac resuscitations to those who suddenly stopped breathing. Secondly, aiding emergency referrals of critically ill COVID patients from local health centers to national referral hospitals. And on a side note, my work also involved doing last office to those who would not manage to be safely evacuated to hospitals or to the areas of safety. Briefly, that's what I can say about that.
Yeah, thank you so much. And your work is so important and valuable. Kind of looking at the last few months and years of this work, Are there any lessons that you have taken away or any important aspects that you think would be valuable to share with us that you have learned?
I have really learned a lot from this pandemic. When the pandemic surged, there was restrictions. In fact, our government put a lockdown, a total lockdown where people were only requested to remain in their homes. If you move out of your home, you just make a few steps in your compound. This showed me how life sometimes can change within a minute. In the course of my duty, I learned that life is really short. I learned to be humble. There are cases where you would be called to go and evacuate, and on reaching on the suspect, is not breathing, is not having a pulse, is having a systole, and you are left with no option other than to break the news to the people who are around. But this case around is not only breaking the news that person has died, but it was more of telling them to keep cautious. This relative who has died can still infect you, and you also follow him or her. So it was really, really, really a learning situation, and it humbled my life.
Yeah, thank you so much for sharing that. And then in terms of kind of what the next 6 months look like for you, what do you foresee in your future?
So currently, maybe to take you a bit slightly behind, when we had cases of COVID-19 reduce, the Ministry of Health in my country, Uganda, scaled down on the volunteers because one, it didn't have enough resources to look after them, because even donations had slightly reduced. And I was among the few health personnel who were laid off, has starting a new kind of life. Currently, what I am planning is to recollect resources to enable me to go back to school and pursue my degree in public health. And this means I have to, again, go back and look for a more awarding job. So in simple terms, I am jobless, I can say, because of the pandemic. So that's what I intend to do, Emily.
Well, thank you so much for sharing your perspective. And it is so important for us to hear about your previous line of work. And I wish you so much luck in the pursuit of your degree for public health. You will be so instrumental in that field. And your line of work and your values are both so important. So thank you so much for taking your time today.
Thank you very much, Emily, for giving me this space. I'm real humbled.